sakit na dulot, ibigay mo kay Bathala. Luha ng kahapon, natin ng ibaon, higpi ng kalooban sa kalangitan isamo. Hayaang maging tala at magsilbing gabay, liwanag na ito sa'yo'y papatnubay. Sa dilim ng landas ng lawang kailangan, sipayo ng kalooban, tanglawang liwanag, ningning ng pag-asa'y makakamtan. Sa gitna ng unos ng law ay lubos, pananampalataya, sandat ng tangan, apoy ng pag-asa siyang tanglaw, apoy ng pag-asa siyang tanglaw. Hawak kamay, sama-samang maglalakbay, hindi bibitiw. Kami ay iyong hawakan sa pagtutulungan. Ang pag-ibig ay tunay, pagninasi ng apoy ng pakikipagkapwa. Umaasang bighati ay matapos, masakit sa lahat, nawa ito'y maglaho. Aming dalangin, sana ay iyong dinggin, aming hinaing sa'yo'y makarating. Tanglawang patnubay sa bighating puso, tanglawang gabay sa naliligaw mundo. Tayo may di man magkasundo, isang tahak, nilatang layunin, at ang lamang nitong ating puso, kapayapaan muling matatanaw, kapayapaan muling matatanaw. Landas ng lawang kailangan, sipayo ng kalooban, liwanag, tingin ng pag-asa'y makakamtan. Sa gitna ng unos, tanglaw ay lubos, pananampalataya, sandat ng tangan, apoy ng pag-asa siyang tanglaw, apoy ng pag-asa siyang tanglaw, hingin ng pag-asa siyang
All right. Good morning, Anticians. Welcome to our health protocol orientation. I am Carlo Jimeno from the Marketing and Admissions Office. Now, this orientation is very important to all of us since we're still facing the threat of COVID-19. We hope that this orientation would help us protect ourselves against the threat of the said virus. But before we proceed, let us put ourselves in the presence of the Almighty to be led by the Student Government President, Mr. Lance Riley Acebo.
Good morning, everyone. Let's put ourselves to the presence of the Lord. God, God of love, you are with us in every transition and change. As we enter into the new semester with excitement and even some anxiety, we recall your... Sorry, sir. We recall your deep compassion, presence, and abounding love. We thank you for the gifts, talents, and skills with which you have blessed us. We thank you for experiences that have brought us to this moment. We thank you for the work of others that gives breath and depth to our own work. Be with us as we move forward, rejoicing with us and supporting one another. We ask this in your holy name. Amen.
All right, so thank you very much, President Aceba. Now, to give us a talk on our health protocols to aid us in mitigating the threat of COVID 19, please all welcome the head of NTC Clinic, Ms. Catherine Rodil.
Thank you, Sir Carlo. Good morning, everyone. This is Catherine Rudil, your school nursing supervisor, and I will discuss to you the latest public guidance and health advice from the WHO entitled Working Together to Prevent Spread of Coronavirus. Before we proceed, we'll talk about the COVID-19 statistics. So as of yesterday, new cases is around 1,862. Newly recovered 765. Then expired 64. Total active cases as of yesterday 28,904. Then total patients who recovered 466,993, and total death is 10,042. Objectives: to learn about symptoms, prevention, and previously asked questions on coronavirus and COVID-19 UK variant, to identify infection in student staff at high risk of developing severe disease due to underlying conditions, to initiate prevention, control measure, and contact tracing, to ensure early identification of cases among students and staff, and to know school guidelines and protocol before entering and while inside the premises. So during March 2020, last year, when pandemic started, actually the pandemic started last December. On March 16, 2020, due to pandemic, President Duterte imposed an enhanced community quarantine in Luzon, which is effectively a total lockdown, restricting the movement of the population except for necessity, work, and health circumstances in response to the growing pandemic of COVID-19 in the Philippines. Then after ECQ, it was modified ECQ. On May 16, the Philippine government has introduced a new form of quarantine to save economies of urban hubs with high number of coronavirus cases. This is the modified enhanced community quarantine. This term was introduced by presidential spokesman Harry Roque. And then GCQ, which was introduced on May 1, 2020, generally less stringent than ECQ. So they made it as GCQ because medyo bumaba ng economy natin. So kailangang bumalik at bumangon ulit ang economy. So let's talk about coronavirus. So this is just an overview kasi alam ko naman na alam nyo lahat kung ano si coronavirus since last year pa to sa atin. So this is just a sort of review lang naman. According to WHO, the disease caused by novel coronavirus or SARS-CoV-2 is now officially called COVID-19. CO stands for corona, V stands for virus, and D stands for disease. What is coronavirus or COVID-19? Oops. Sorry po, wait lang po. So coronavirus disease 2019 or COVID-19 is a respiratory illness that can spread from person to person. The virus that caused COVID-19 is a new coronavirus first identified during an investigation into an outbreak in Wuhan, Hubei province, China. Initial case patients reported visiting a large seafood and live animal market in Wuhan. So initially, akala nakukuha si COVID-19 is from large seafood or live animal, pero after na ma-discover, person to person pala yung transmission. So we will discuss also here the COVID-19 UK variant. Ito yung bagong variant na pumasok sa atin. As we all know, last January 7, merong na-found na positive with the UK variant. So talking about COVID-19 UK variant, the UK strain commonly known as B-117 is a more contagious strain of the coronavirus. It is first emerged in the UK in late 2020. Health officials said the current vaccine are believed to be effective against the variant. So, itong UK variant na to, walang pinagkaiba sa COVID-19. Parehas lang sila ng symptoms. Yung treatment, wala pa rin. Pero since may vaccine, may possibility na ma-mitigate din ng vaccine na ita-trial sa atin si UK variant. Pero wala pang ganon kadaming data. So, hindi pa siya talaga sinasabi na pwede siyang gamitin sa UK COVID variant. So, a domino effect of UK travel bans over mutant virus. A fast-moving new variant of COVID-19 that is believed to be 40% to 70% more transmissible was first discovered in Southeast England on September 20 and confirmed on December 19. Actually, bago dumating itong mutant variant na to, may mga variant din na dumating tayo, katulad ng yung mga nauna na may mga strain din, pero ito lang yung tumuloy talaga na nakita nila na nag-positive ang tao. London as well as large part of Southeast and East England entered 2 weeks of the tire for restriction starting from December 20. 1,107 people in the UK has tested positive for the new variant by December 13, most to whom are under 60, but research suggests the variant isn't more dangerous. So next slide. The list of identified countries with travel restriction. Because of this, nagkaroon tayo ng travel ban ulit dahil para lang ma-mitigate, para ma-control din lang din yung pagdating ng UK variant. Kaya lang, may mga nauna na rin kasi na mga country, pero first time na nakapasok sa atin yon nung after ng January 7. So, list of identified countries with travel restrictions are Australia, Brazil, Canada, Denmark, Finland, France, Germany, Hong Kong, Iceland, India, Ireland, Israel, Italy, Japan, Jordan, Lebanon, Netherlands, Norway, Portugal, Singapore, South Africa. Initially, ang travel ban lang are only 21 countries. Pero bago dumating si UAE sa atin, nadagdagan to ng 7 country, and these are South Korea, Spain, Sweden, Switzerland, United Kingdom, United States, then Austria. And then yun nga, yung latest, kaya na-travel ban na si UAE kasi may nakapasok na sa atin sa Pilipinas. Yesterday, nabasa ko sa DOH na yung mga nagkaroon na ng contact tracing regarding dun sa businessman and woman na nakarating dito sa atin. So yung 5 na nakakontak niya, nakasama niya sa household positive. Then isa din doon yung nurse na nag-attend sa kanila, nag-positive din. Pero sa UK variant, wala pang result. Positive COVID pa lang din sila. Ang country natin, siguro may nagtatanong bakit hindi pa i-travel ban lahat ng mga foreigner na papasok sa Pilipinas. Hindi po pwede yon. Ang Pilipinas po or ang DOH or ang mga health authority po, naghihintay din po yan ng go signal from the other country kung meron ng variant na nakapasok sa kanila. Kapag nagbigay na po sila ng go signal or ng news or ng update sa kanila na may COVID variant doon pa lang nila ibaban yung isang country sa Pilipinas. Next slide po. Additional information, health expert in US and UK said the variants seem to infect more easily than other, but there is no evidence yet it's more deadly. Si UK variant po is madaling matransmit. Madali siyang makahawa, person to person pa rin, pero hindi po siya ganon ka-deadly katulad po ng COVID-19. Because the variant spread more rapidly, they could lead to more cases and put even more strain to our heavily burdened healthcare system, said Dr. Henry Wok of Center of Disease Control and Prevention. Researchers believe that current COVID-19 vaccine will likely protect against B-117, but data is needed. Yung po yung sinasabi ko sa inyo kanina na may vaccine na nga available for COVID-19 na pwedeng gamitin kay UK variant, pero kailangan pa ng more data. The virus would likely need to accumulate multiple mutation in the spike protein to evade immunity induced by vaccine and by natural infection according to the CDC. Yung natural infection po, yung sinasabing herd immunity, yun po yung ma-acquire natin from infection pa rin. Pwedeng active or passive. Pag sinabing active, yun po yung pag na-infect tayo, nagkakaroon tayo ng immunity. Pag sinabing passive, yun yung nanggagaling sa vaccine. The researchers first identified the B-117 variant in the US in Colorado. On December 28, 2020, in a COVID-19 patient with no reported travel history, suggesting that the virus was spreading from person to person in the community, it is unclear how widespread the variant has become. So person to person pa rin, like COVID-19 po. So parehas din siya ng mga kung paano matransmit. Next slide po. Then signs and symptoms of COVID-19. Signs and symptoms of COVID-19 is just the same po for the UK variant. So signs and symptoms are cough, fever, shortness of breath or difficulty of breathing, chills, muscle pain, headache, sore throat, new loss of taste or smell, congestion or runny nose, nausea or vomiting, diarrhea. So an individual with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. As we all know po, once na nagka-symptoms ngayon during pandemic, especially kung meron kang cough or sore throat, you were advised to isolate. Kunyari po, isang individual nag-attend ng gathering, then after 2 days or kinabukasan after attending gathering, medyo naging down yung system niya, nagkaroon siya ng flu-like symptoms. So kapag ka ganun po yung case na alam niyo naman lumabas kayo at na-expose kayo sa ibang tao, pwede po kasing nakakuha kayo doon ng infection, much better po to isolate yourself. Hindi po kasi katulad tayo nung una na kahit may ubo ka, kahit may sipon, pwede kang pumasok sa school or ma-report. Since may pandemic po tayo, tinitreat po natin lahat ng symptoms as one, as COVID-related symptoms po. Next slide po. Then transmission of COVID-19. COVID-19 is spread primarily from person to person. Droplet release when someone sick sneezes or cough can land on the mouth or noses of people nearby. Close contact with someone sick like hugging and shaking hands. Kaya these days po, simula po nung nag-pandemic, hindi na po allowed ang shaking at saka ang hugging po. How does it spread? Once contaminated hands can transfer the virus to your eyes, nose, or mouth. From there, the virus can enter the body and make you sick. That's why sinasabi po parati ng DOH na kapag ka nag-touch kayo ng any object, before touching your eyes, nose, or ears, lahat ng mga reservo natin sa katawan, kailangan po mag-disinfect muna. Then next slide. So COVID-19 mainly spread from person to person but can also be left on object or surfaces. Alam naman po natin lahat ito na natatransmit ang infection not only from person to person pero yung mga highly touched object. So like doorknobs, let's say may sipon kayo, hinawakan nyo si doorknob without without using tissue nung hinawakan niyo yung ilong nyo. So, might as well ma-infect po yung susunod na hawak doon. As well as your laptop and mouse. Then, yung leave button, yung sa elevator po. Then, mga cellphones, digital device. Then, yung pens po. So if you touch something contaminated and then touch your face or another face, you might all fall ill. So speaking of surfaces po, I just want to give information regarding the virus time frame for you to know as to how many hours the virus can stay in one area. So kapag sa air po, let's say may nag-sneeze, viruses can last up to 3 hours. Pag sa copper, 4 hours, paper and cardboard, 24 hours, stainless steel, 2 to 3 days, then plastic po for 3 days. Then next slide, COVID-19 severity. So next topic po tayo. So currently, 4 of 5 people infected with COVID-19 will experience mild or moderate symptoms. How can you categorize ba mild and moderate? Actually, mild, moderate to severe na po kasi yung sunod. So if mild po, pag sinabi pong mild, you'll be having a fever of 100.4 degree Fahrenheit or 38 degrees Celsius. Then magkakaroon ka ng cough, sore throat, muscle ache, and fatigue, then loss of smell and taste. Ang common po sa COVID-related symptoms talaga, yung kapag ka talagang positive ka sa COVID, is yung may loss of smell and taste po. And then, pag sinabi pong severe, may dehydration na po. Dehydration, to the point mo na nagsushoot up po yung temperature nyo up to 40 degrees Celsius. Then, co-infection like bacterial infection. Difficulty of breathing, yung hirap kang huminga, bukod dun sa hinahapo na tolerable sa bahay, iba po kasi yung hinga nung talagang may shortness of breath na kailangan nang ilagay sa makina para ikabit sa makina para yun yung magsusupply sa kanya ng oxygen direkta sa kanyang lungs. Then pneumonia, ito yung pag in-x-ray ka, dun matitrace kung may pneumonia ka. Then it will result to kidney failure. Usually kasi, pag sinabing kidney failure, kaya bawal na bawal lumabas yung may mga comorbidities kasi sila yung madaling mahawa. Madami na kasi silang maintenance. So, hindi na ma-absorb ng katawan yung gamot na binibigay. So, magli-lead talaga siya sa kidney failure. Then, kapag ka na-overload na siya, it will lead to respiratory failure. Then, might lead to death also. Next slide po. So far, children and adolescents have been far less affected by COVID-19 and their symptoms have almost always been mild. So yun nga, kaya ina-advise or mas may age bracket kung sino lang yung pwedeng lumabas at kung sino yung pwedeng magstay sa bahay. Next slide. While COVID-19 is often mild, it is spreading quickly. We all need to work together now to protect the most vulnerable. Healthcare workers, people over 60 years old, to protect most vulnerable. Pag sinabi pong vulnerable, ito po yung mga healthcare workers kasi sila po yung madalas na naka-expose sa mga patient with COVID-19. Then people over 60 years old, ito po yung mga seniors natin with mga may comorbidities and those with underlying health condition. Pag sinabing underlying health condition, ito yung may mga tinitik na maintenance, katulad ng may mga heart or lung disease, diabetes. Pag sinabing immunocompromised, ito po yung mga nagki-chemotherapy na patient. Ito rin yung may mga post-renal kidney transplant na patient. So, recognize and respond to COVID-19. So, recognize COVID-19. Ito po yung sinabi ko sa inyo kanina. In mild cases, you'll be having cough, fever, and fatigue. In moderate cases to severe cases, initially muna, mild pneumonia. Pag sinabing mild pneumonia kasi, isang lobe lang ng lungs, kunyari, kanan or kaliwa lang. Pag sinabi namang severe na to, both lungs meron na siyang pneumonia, infected na parehas. So, doon nagkakaroon ng difficulty of breathing and may possible lead to death. Then, next slide po. What to do if you feel unwell? So, sa low risk po, low risk meaning ikaw yung under 60 years old. So, and without underlying health condition. So, you may be asked to self-monitor, self-isolate, stay home until you are well. So, ito po yung mga tao na may mga individual na may mga mild symptoms lang po, katulad po ng yung mga fever, ito po yung mga nakakategorize lang as a mild cases. Pero hindi po lahat ng low risk or ng 60 years old below na walang underlying health condition is hindi pwedeng mag-lead sa moderate or severe case. Case-to-case basis po yung symptoms natin. So, hindi mo pwedeng sabihin, ay, low risk naman ako kasi below 60 years old ako. Kahit nahihirapan akong huminga, siguro hindi ko naman kailangan pumunta sa hospital. Case-to-case basis po kung ano po yung present na nararamdaman nyo. So high risk po if you're over 60 years old and have an underlying condition. Sinabi lang po itong high risk kasi sila po yung mga tao na pwedeng mahawa agad-agad. So kaya po ina-advise na magpakonsulta po agad sila kasi hindi po sila pwedeng mag-take basta-basta ng gamot kasi pwedeng magkaroon ng adverse reaction yung gamot na iniinom nila dun sa gamot na presently na minemaintain nila. So, parati po silang ina-advise na mag-consult para kahit pa paano tama po yung medication na ginagamit nila. Hindi po pwedeng mag-self-medication, in short po. So, next po, quarantine and self-monitoring. So, ito po yung nangyari sa atin sa lahat ng mga na-infect ng COVID and sa atin na rin lahat nung nag-lockdown to prevent the spread of COVID-19. So, kapag quarantine po, you may be asked or choose to stay in quarantine, either quarantine facility or at home po. Nung una-una na pandemic, lahat po ng positive COVID were encouraged to stay in home quarantine facility. Pero nung naging full house po kasi dumami po yung mga cases natin, ang nangyari po, yung iba na may mga positive cases, hindi na kayang i-accommodate ng health facilities and hospital, sa bahay na lang po pinag-i-stay. Pero ang nangyari po noon, kino-cohort po. Let's say sa isang member of the family, meron po tayong 10 cases. Ang nag-positive po doon, 7. And then meron pong 3 negative. Iko-cohort lang po yon. Yung mga positive po, pagsasama-samahin sa isang bahay, yung negative po, ihiwalay dun sa positive, sasama sa isang bahay, pero naka-ano pa rin po sila, naka-quarantine pa rin po sila. So, hindi po natin pwedeng palabasin din si negative. Ay, pwede ako lumabas kasi negative ako. Hindi po, kasi it's either negative ka po sa result, pero carrier ka po. So, pwede ka rin po mag-spread ng infection. So, ang quarantine po, ina-advise po ito na national authority. If you were recently exposed to COVID-19 or traveled to infected countries, or if you were in contact with confirmed case, then ika-quarantine ka rin po to avoid potential transmission. So, COVID-19 quarantine do's and don'ts. So, do's po, ang mga do's po, you have to stay at home, then i-separate nyo po yung mga utensils mo rin. Tapos po, dapat po, kahit naka-quarantine pa rin kayo, keep in touch pa rin po yung family niyo sa inyo para naman po kahit pa paano alam niyo may kasama kayo during those time. Then, imo-monitor niyo pa rin po yung health and symptoms niyo including fever, cough, or fatigue. Kung sakali pong mag-worse yung symptoms ninyo, inform niyo po agad yung mga healthcare workers po. And then, don'ts po, hindi ka po allowed lumabas ng bahay, hindi ka allowed umattend ng kahit anong gathering, hindi ka rin po allowed na sumakay sa mga public transportation kasi yung mga sumasakay sa public transportation, syempre may mga trabaho po yun. Gusto rin naman po nilang kumita kasi kung hindi sila magtatrabaho, wala po silang ipapakain sa family nila. So kawawa naman po kung ikaw po mismo maging irresponsible and then alam mo po naman na may exposure ka or positive ka sa COVID tapos lalabas ka. Kawawa po kung may infect mo sila kasi mas marami ka pong madadamay. So, next slide po. So, how can I really tell if I am sick with COVID-19? A cold, flu, or any other disease. So, you can't even a doctor can tell just by looking at you. totoo po yan. Pag sinabi mo pong, ay, may sipon lang naman ako, okay lang yun. O kaya, ay, may sipon, may COVID na yata ako. Hindi po yung ganon. All you have to do is just to observe yourself. Kung sa tingin nyo po na sipon lang yan dahil may allergy po kayo, observe nyo po, kung the whole day po magkakasipon kayo, then the following day, pag gising nyo, may sipon pa rin kayo, yun po, sipon na po talaga. Pag po kasi sinabing allergy, na kunyari allergic rhinitis, sinisipon kayo bigla, maya-maya wala na rin po. Once na na-expose lang po kayo sa mga triggering factor. Then, ang doktor po, kahit saan po kayo magpa-check up these days, hindi lang po kayo basta re-resetahan. Kung meron po kayong cough or fever or colds, most likely po magpa-investigate po yan, mga diagnostic test like chest x-ray, or pwede po kayong i-advise na magpa-swab test din. So, next slide po. So, COVID-19 testing. So, in COVID-19 testing, make sure it's one involving a nose and or throat swab. At the moment, these are the only tests available which can tell whether you are infected with the virus now. So, ang testing po na available natin, next slide po. Which COVID-19 test do I need? So, as you can see, may bracket po dyan. May tanong dyan, was I sick in the past? So, pupunta po siya sa antibody test. Am I sick now? So, pupunta siya sa RT-PCR and then sa antigen test. So, ang difference po niyan tatlong test, etong antibody test, ito po yung rapid test na sinasabi natin. Tells us if we had the virus in the past, but not now. Ito po yung ang best na magpapatest po dito is yung mga nagkaroon ng, naging positive sa COVID before. Pwede niya pong ipatest, let's say tapos na po yung quarantine niya na 14 days, minsan may nag-a-advise na doctor, sige pa-rapid test ka para makita natin. So pag nakita po doon na positive po yung IgG, yun po yung antibody natin. Pag positive yun, ibig sabihin nagkaroon ka po ng immunity sa COVID-19. Pero hindi po ibig sabihin na safe ka pa rin. You have to still follow the preventive measure. Then RT-PCR test po, ito po yung gold standard po natin na sinasabi. Ito yung pwedeng gamitin si screening test. Kunyari, sa mga nagta-travel, ito po yung ginagamit talaga as screening lang. Kung bago ka paalsin, dapat malaman, dapat negative ka. So, ito naman po, ang result po ng rapid test will take 1 to 2 hours. Alam niyo na po yan. Then RT-PCR test, ito po yung pinakamatagal. Result will take 2 to 3 days. Pero minsan, kapag siguro hindi ganun kadami yung tinetest nila, pwedeng nagpa-test ka ngayong umaga, sa gabi may result ka na. Pero very rare na nangyayari yan. Pero may nangyayari talaga. Then antigen test po, ito rin po yung pwede mong ipatest kapag sick ka. Ang the best po na paggawa mo yung antigen test, swab test din po ito. Ang best po nito is may symptoms ka. Pero as screening, hindi rin po siya advisable. Then once na nag-positive ka po sa antigen test, i-advise ka pa rin po for confirmatory sa RT-PCR test. So parang waste of money pa rin. Kunyari, gusto mo magpa-test, natatakot kang magpa-RT-PCR, ay rapid test na lang ako kasi mas mura. Pag nag-positive ka po sa rapid test, yung IgM na sinasabi, may confirmatory pa rin po yon sa RT-PCR test. So, another bayad ka na naman. Ganon din po sa antigen test. Pag nag-positive ka po dyan, kasi lesser din po yung bayad niyan. Pag nag-positive ka po sa antigen test, may confirmatory test pa rin po ng RT-PCR. So, just to save money po and to be more practical, kahit mahal po si RT-PCR test, dun na lang po tayo sa gold standard. Then, next slide po. You may have to take a COVID-19 test and get a negative result before or during travel. But remember, it's not the golden ticket. You can still become infected. So, ibig sabihin po nun, let's say ako, nagpa-test ako ngayong araw na to, lumabas negative ang result, ngayong araw din to, hindi ko pwedeng sabihin sa akin, oy, mayabang ako kasi negative ako sa COVID test. Kinabukas, kunyari, once po kasi, na pag lumabas ka ng testing facility, kunyari ako nagpa-test, lumabas akong testing facility, nalaman ko na negative ako. Pagkalabas ng testing facility, dumaan ako sa mall, o kaya sumakay ako ng public transport, hindi ko na alam kung na-infect ba ako o hindi kasi na-expose na ako. So, the following day, pwede ka rin mag-positive doon pag nagpa-test ka. Kunyari, nagkaroon ka ng symptoms, oy, ba't nagkaka-symptoms ako? Negative naman ako sa swab test nung isang araw. O, so kung nagka-symptoms ka, so malamang nagkaroon ka ng exposure dun sa mga dinaanan mo after, na pumunta ka sa testing facility. So a negative COVID-19 test result is not guaranteed that you're infection-free. The next slide po. COVID-19 contact tracing. So COVID-19 contact tracing, dito na po pumapasok yung kapag ka na-found out po ang isang tao na positive. So hahanapin po ng LGU or ng health workers kung sino yung nakakontak mo within the span period of time. So contact tracing helps to identify, to inform, and to isolate. Identify time and places where people have had contact with someone who has COVID-19. Then inform people who might have been exposed. Then isolate people with COVID-19 to prevent further spread. So, ito po yung contact tracing. Kailangan po kasing i-trace yung mga na-expose sa nag-positive kasi kapag ka hindi po na-trace yun, maaari pong carrier po yung na-expose na yon and then ikalat pa rin po niya yung infection. So, talagang hindi po mamimitigate yung spread ng COVID-19. So contact tracing can break the chain of transmission. Ito po yung sinasabi ko. You might be asked who you have been seen and where you have been recently. Sharing these details help health authority identify people who might be at risk of COVID-19 and keep the people around you protected. So hindi rin po naman natin masisisi yung iba na i-disclose kung anong meron sila kasi nga po marami po silang fear. So next slide po, COVID-19 and mental health. So ito po yung usual na naramdaman natin during pandemic. Kahit po ako, natakot din ako nung nagkaroon ng pandemic kasi natatakot din naman akong mahawa. Lahat po tayo, tao lang po. So it is normal to feel fearful and anxious during this time. Talking about your feeling will lessen your distress. So, we all have a role to play in protecting the physical and mental health of ourselves and others. Know that the fact about COVID-19 and help to support the positive mental well-being. It is normal to feel fearful and anxious during this time. Talking about your feeling will lessen your distress. And it is important to spend time doing things you enjoy and find relaxing. So, pwede nyo namang i-divert yung focus ninyo or para rin ma-lessen yung worry ninyo, mas maganda yung manood kayo ng news dun sa may mga talagang certified na nagde-disseminate ng mga news na yun tama lang. Kasi yung iba exaggerated naman na talaga. So, hindi nawawala yung takot. And then, losing someone we love is always difficult. Yun, may mga nawawalan po tayo ng mga kababayan. So, kailangan din pong intindihin natin kung ano po yung nararamdaman nila. Kahit naman po hindi pandemic, pagka nawalan po tayo ng mahal sa buhay, mahirap po talagang tanggapin sa una. People diagnosed with COVID-19 deserve compassionate care. Helping them stay connected to their loved ones by phone, video, and messaging can provide comfort during isolation. So, mas maganda po na let's say meron tayong kamag-anak or kaibigan na hospitalized, mas kailangan po kasi nila ng kausap kapag ganito na nagka-COVID sila. Kasi bukod sa fear, natatakot sila na baka nga naman maging worse kasi ayaw nilang dumating dun sa point na bigla silang mawala or ayaw din nilang dumating dun sa point na kung ano-anong maisip nila. So mas maganda po, keep in touch pa rin po dun sa mga kaibigan natin or mahal na sa buhay natin na nandun sa status na ganun. So feeling low can lead you to withdraw from your usual activity. This is a common reaction to trauma, but over time, it can also lead to a cycle of inactivity. Try to find the motivation to do the activities you enjoy. This will help restore your mental health. So next slide po. Avoiding social stigma and discrimination. So dito na po pumapasok yung worry ng mga tao kaya ayaw nilang i-disclose na iba yung nararamdaman nila or may COVID-related symptoms na po sila. Viruses don't discriminate and neither should we. So COVID-19, addressing social stigma and discrimination po, we all have a role to play in protecting the physical and mental health of ourselves and others during the COVID-19 outbreak. So next slide po. Evidence show that stigma due to coronavirus lead to reduction in people seeking medical care or testing. Ito na po yun, yung takot po sila. Kasi yung iba po kasi talaga, meron naman po kasing ibang tao na kapag nalaman COVID, then naka-recover, parang natatakot silang lumapit dun sa taong yun. Ay, nagka-COVID yan. Makakatakot siya, wag ka lumapit. Kaya yung iba talaga, yun, hindi na lang sila nagsisik ng medical care. Reduction in people adhering to intervention including self-isolation. Kasi marireduce talaga yung sa self-isolation kasi isipin, bakit kaya hindi lumalabas ng bahay itong si kapitbahay? Siguro may COVID na to, ganyan. So, ang nangyayari, instead na mag-isolate sila, kahit may symptoms sila, magpe-pretend sila na they are still okay. This can lead to cases that being reported and more people being exposed, which makes responding to the outbreak more difficult. So, next slide po. COVID-19 domestic violence. So, COVID-19 domestic violence. Children, women, and older people are at higher risk of domestic violence during and after the COVID-19 pandemic. So, sa mga children po, more time is spent on the internet increases the risk of online abuse. And then sa women naman po, measures such as home quarantine may increase risk of sexual coercion and violence. And sa older people naman po, these are those at higher risk of severe disease may stay home to reduce risk of infection. This may result as social isolation, abuse, and reduce opportunity to seek help. So next slide po. Preventive measure na po tayo. So, alam naman po natin lahat kung ano po yung preventive measure na kailangan natin gawin. There are numerous ways and action to prevent and treat and protect yourself and others from COVID-19. The primary tools on prevention is self-discipline. All action should start from yourself. From putting your face mask on, face shield and hand washing, social distancing, and avoiding mass gathering and transportation. All those prevention requires to be acted by yourself. So even if you are less than 60 years old and do not have an underlying health condition, you can still become sick with COVID-19. So yun po. So ang preventive measure natin, always clean your hand often. Clean your hand often. Then cough or sneeze in your bent elbow. Minsan po, hindi natin maiwasan kasi ang sneeze kasi, bigla na lang siyang mapi-feel mo nag-sneeze ka. So, minsan hindi mo na maiisip na mag-sneeze ka dito sa bent elbow. So, ang una natin, ang first line natin to cover is yung kamay natin. Okay lang naman po yan, hindi naman po sinabing bawal. Kaya lang, as much as possible po, after nyo pong isnisan yung inyong kamay or yung inyong palm, mas maganda, advisable po talaga na hugasan niyo yung kamay niyo or kung wala naman tubig, may alcohol kayo, mag-disinfect po muna kayo before touching any object. Avoid touching your eyes, nose, and mouth. Limit social gathering and time spent in crowded places. So, ito po yun. Usually po kasi, dun po yung may cluster sa mga crowded places. So, mas maganda po na iwasan po natin pumunta sa mga ganon. Kunyari, kayo lang yung lumalabas para bumili ng grocery, pwede naman po kayong pumunta mga lunchtime kasi sigurado po wala pong tao nun. Avoid close contact with someone who is sick. So, yun, social distancing po, and then dapat po talaga ina-isolate na. Clean and disinfect frequently touch object and surfaces. Yan. Talagang must po na parating mag-disinfect. Kasi katulad ng cellphone, gawin niyo pong habit na at the end of the day, i-disinfect niyo siya with alcohol. Pwede rin naman po na kung sa tingin niyo po na dumihan siya, hindi niyo na po kailangan matapos yung buong araw. Pwede niyo pong i-disinfect anytime. And then next po. Next is physical distancing. So, yun, marami po kasing mga example ng physical distancing. Kunyari, pag nagkaroon ka ng symptoms, so you have to do self-isolation or self-quarantine. And then, kunyari po, papasok ka sa school. Dito po kasi sa school, meron po kaming sinasabi na 14 14-day cycle. 14 days magre-report, 14 days na nasa bahay. So para po, at saka hindi po lahat ng empleyado pumapasok dito. Ilang percent lang po yung pumapasok para po kahit paano ma-maintain po yung social distancing. Even po sa corridor or lalakad ka lang sa labas, naka-face mask, face shield pa rin po ang mga empleyado. Then, kunyari, sa mga gathering po, instead na mag-attend po kayo ng party, better to stay at home. Pwede naman pong virtual, makipag-video call na lang po kayo sa mga nagpa-party. Or kung kamag-anak nyo naman po, sa bahay po, sa loob ng bahay, make sure kayo lang po. Nakakaraos naman po tayo, especially po nung holiday po, siguro, napakalaking difference po ng pag-celebrate natin ng holiday. Pero nagkaroon pa rin po ng surge after the holiday. So, yung shaking hands and hugging, next slide po. Instead na mag-hug po tayo and mag-shake hand, wave na lang, bawo tsaka nod. So, kung mag-grocery po, if possible po, pwede naman pong online. Pero kahit ako, I myself, hindi ako komportable nung sa grocery. Mag-online ako kasi mas gusto ko nakikita ko. Pero sa palengke, since luckily na may bumibili sa amin, may lumalabas dun sa compound, na namamalengke, sila na talagang pinapabili ko. Then how to guide for another how to guide for physical distancing. Kunyari mag-gym ka, pwede mo naman gawin sa bahay muna. Kasi sa gym, close kasi siya, and beside doon, hindi naman kayo pwedeng mag-gym na may face mask kayo. So yung oxygen demand syempre magdi-decrease din. So yun po yung mga way ng social distancing. So let's go to COVID-19 and food safety. So the current evidence suggests that COVID-19 is spread primarily from person to person rather than via food or food packaging. However, it is always a good idea to prepare nutritious food for ourselves and our family and to learn how to do safely. So to prepare safe and healthy food at home, apply 5 key for safer food. Keep your hand on surfaces clean, separate raw and cooked food thoroughly, keep food at a safe temperature, use safe water and raw materials. Shop safely, make smart food choices, and protect yourself from COVID and many other diseases. So mas maganda po, meron kayong shopping list. And then, i-plan nyo po, then bago kayo umalis at least, kahit pa paano, dire-diretso lang po kayo dun sa mga bibilihan nyo. Then, kunyari, pupunta kayo sa supermarket, kailangan pa rin po i-maintain nyo po yung social distancing, keep at least 1 or 1.5 meters from other. Then, i-check nyo rin po yung expiration date ng food nyo na binibili. Then, yung packaging po, kung walang damage, prioritize fresh product and fruits and vegetable. Sanitize your hand after touching money and other surfaces. So, parati po dapat kayong merong sa packet na alcohol. When you return home after grocery, wash your hand with soap and water. Then, yung pong mga unpacked food, usually yung iba, kinagawa po, i-disinfect muna nila. Actually, yung iba nga sa bahay, meron ng yung disinfection mat na sinasabing tatapakan muna bago pumasok. Depende po yung case to case. Kung wala naman po kayong ganun, pwede nyo na lang pong tanggalin yung shoes nyo, huwag nyo pong ipasok sa loob, iwan nyo po yung dirty shoes na ginamit nyo, then mag-apak na lang kayo papasok. Alam nyo namang malinis din yung bahay nyo, and nadi-disinfect nyo rin naman po. Then, you have to wash your hand with soap and water. Pero kung hindi po kayo sure, dun sa pinuntahan nyo, medyo crowded, pwede naman po kayong maligo right after na dumating po kayo sa bahay. Diretso na po muna kayo. So, let's go to Clinical Trials 101. COVID-19 vaccine trials. So, next slide. What is vaccine? A vaccine is used to stimulate our immune response to provide protection from a specific infection pathogen that cause diseases. So, ang vaccine po, hindi po ito medication. Ito lang po yung pang-control para po hindi na po kumalat si COVID-19. What is vaccine clinical trial? There are medical studies that involve people. The main objective is to evaluate how safe and how effective the vaccine under investigation are for human before license for use. Vaccine clinical trials look at the comparison between outcome in those vaccinated and those who aren't to see to see if protection is observed. Sorry po. Pag sinabi po kasing clinical trials, may mga stages po kasi to. So, hindi to basta-basta i-inject sa tao unless nagkaroon po ng bioavailability. Ang bioavailability po, ang meaning po nun, may mga certain patients na nandun. Yung mga pasyente yon, healthy well-being po yon. And then, sila po yung itetest. Sila yung makaka-receive ng mga medication. May bibigay sa kanilang injection. Titingnan nila kung anong side effect nun. It's either in one day, i-observe sila for 12 hours. Depende po kung ano po yung medication na itetest sa kanila. Pero dito sa vaccine, iba rin po yun, syempre, yung setup na ginagawa. So, next slide po. Next slide, what is the criteria for eligibility? So, bago ka po mailagay sa trial, may physical examination po. I-check din po yung state of health mo. Dapat wala kang kahit anong sakit, wala kang tinitik na maintenance. And then, yung COVID-19 status mo, dapat hindi ka po na-expose previously sa COVID-19. And then, other diagnostic test. What is the importance of conducting clinical trials in the Philippines? The vaccine need to be tested in the Philippines to make sure that it is safe, produces immunity, provides protection against COVID-19. What are the right clinical trial participants? So, dito po papasok yung right to know. Sorry, hindi ko mabasa. Wait lang po ha. So, right to know compensation, if any. Right to privacy and confidentiality. Right of belief. Right to documents. Right to post-trial care. Right to complain, right to ask, right to full disclosure, right to be informed of the risk, right to clear information, right to decide, right to refuse. So kunyari, mag-a-under po kayo ng clinical trial, ito po yung lahat ng rights na meron tayo. Kung sakasakali na hesitant po kayo, and nandun na po kayo sa trial, hindi naman po ibig sabihin hindi na po kayo pwedeng mag-back out. Pwede naman po yun kasi that's for your peace of mind and kayo po yun eh. Are there possible side effects? Yes po. Actually, in-interview ko, or hindi naman interview, nakakwentuhan ko po kasi yung kasamahan ko dati, na nurse na nagtatrabaho sa hospital. She received vaccine already, and yung common na side effect is headache daw, moderate. Hindi siya yung basta-basta headache lang, medyo moderate siya, medyo masakit, pero tolerable daw naman. And then, dun sa second dose na binigay, dun yung talagang may mga symptoms na ang symptoms daw just the same with COVID-related symptoms. So kung ano yung nafe-feel mo nung nagka-COVID siya, kasi nag-positive COVID siya eh. Kaya alam niya kung ano yung nafe-feel nung may COVID dun sa naka-receive ng vaccine. So, nung naka-receive siya ng vaccine, na-feel niya doon yung may body weakness, yun daw talaga yung hindi niya nakakayanan. Kaya hindi siya pumasok the following day. Pero wala naman dun yung loss of taste and smell. May possibility rin, kahit naman anong vaccine, may possibility na bigla kang sisipunin, bigla kang magkaka-flu-like symptoms. Effect lang po kasi yun ng cold chain. Then, next slide po. So, how a new vaccine is developed, approved, and manufactured. So, ito po yung sinasabing clinical trial. Sa phase 1 po, healthy volunteer po. So, ito po yung sinasabi na phase 1 to phase 3. So, since nasa phase 3 na po tayo, since nasa phase 3 na po yung vaccine, doon na po yung time na pinapadating na po dito sa Pilipinas. So, sa phase 1, muna mag-start po tayo. May volunteers po doon na 20 to 100 healthy volunteers. Ito yung initial. Ito yung kauna-unahan. Is this vaccine safe? Does this vaccine seem to work? Are there any serious side effect? How is the size of the dose related to the side effect? Then phase 2 po, several hundreds of volunteer na po yan. Ibig sabihin, pag pumasa po sa phase 1 at wala naman po nakitang any adverse reaction na yung sobra-sobra, mag-aano po sila. Siyempre, pupunta na sila sa phase 2. So, what are the most common short-term side effect? And then, how are the volunteer immune system responding to the vaccine. Then pagdating po sa phase 3, ito na po yung i-expose po yung 100 or thousands of volunteers. So dito po papasok yung clinical trial na sinasabi. So how do people who get vaccine and people who do not get the vaccine compare? Bali po, ang percentage po kasi sinasabi ang effectivity ng vaccine, hindi po ibig sabihin ng let's say, sa 10 pong nagpa-vaccine, yung isa po is yung isa po hindi po nagkaroon ng hindi siya nag-develop ng antibody. Tapos yung 9 po nag-develop. Hindi po ganun yung percentage na pagkuha doon. Ang sinasabi po doon, pag nag-vaccine ka po, kung ano yung efficacy niya, ibig sabihin, sa nagpa-vaccine po versus hindi nagpa-vaccine, doon sa nagpa-vaccine, 100% po doon yung nagkaroon ng immunity, and then doon sa hindi nagpa-vaccine, sila yung may sakit, doon po nakikita yung efficacy naman. So, yun po yun. What are the most common side effect? Yun. Chine-check din po yan pa rin dun sa phase 3. May phase 4 pa po, hindi lang po nakasama dito. Yung phase 4 po, yun yung pong i-review po. Parang i-recheck pa rin nila kung ano yung nagiging effect pa rin after ng phase 3. So, hindi pa po yung nagtatapos sa phase 3 lang. So, next slide po. So, may siguro may times na darating kayo sa point na kailangan yung pumunta sa school para magbayad ng magbayad ng tuition, or may i-process po kayo sa may i-process po kayo sa registrar. So, kailangan nyo rin pong malaman ang guidance and protocol inside the school premises. So, no ID, no face mask, no face shield, no entry. Kahit po visitor, even not student, hindi po namin ina-allow na pumasok dito sa school nang walang kahit may face mask, then walang face shield, hindi po namin ina-allow yon. And then, an individual below 18 years old and more than 65 years old are not allowed to enter the premises. So, kasi po ito, according to IATF po kasi ito kapag po 17 years old po kayo, then nakita po namin, minsan po kasi, nadidisregard din, hindi napapansin ng mga nasa una, ng guard na nag-check, na may nakakapasok pala. So, sa amin kasi yung second line, i-check namin yung health issue dun sa triage form. Pag nakita namin na 17 years old lang siya, hindi po na talaga namin kinikater. Pasensya na po kayo. So, doon sa mga 17 years old, magstay kayo sa bahay nyo kasi hindi rin kayo may entertain dito. Sayang lang po yung effort niyo sa pagpunta rito. Kasi we have to follow the IATF rule. Kasi kung sakali po na found out na na kinikater namin yung below that age or above that age, pwede po kasing managot yung mismong National Teachers College. So, ganyan po tayo kay stricto. Hand washing, sanitizing upon entry. So, kung hindi pa po kayo nakakapunta rito, pagpasok po ninyo sa visitors entrance, meron po dong laboratory where you can wash your hand before entering po. Then, health declaration form must be filled up. Sa ngayon po, health declaration form po. Hard copy pong ginagamit natin, pero we are trying to find a way para po maging paperless na lang po. And then body temperature will be checked or will be taken. If the temperature is 37.5 and above, the student will not be allowed to enter the premises. So kung may lagnat po kayo at feel nyo, alam nyo na may lagnat kayo pero kailangan yung pumunta sa school, wag na lang po muna. Kasi as I'm saying, masasayang lang po yung effort nyo. Kailangan din po kasi natin protektahan yung mga tao makakasalamuhan nyo. And then, minimum po tayo ng 1.5 meter social distancing. Ini-implement na po dito yon. So, hiwa-hiwalay po talaga yung chairs. And then, kahit po sa pila, ganun pa rin po. And then, if you are sick po, please do not visit. Kasi, meron din po kasi tayong mga empleyado dito sa loob na pwede ninyong mahawa. Yung iba po, kahit sick, hindi nila dinedeclare. Sana po maging responsible po tayo. Kasi kung ikaw lang po yung may sakit, pag pumasok ka po dito, mas madami pa pang magkakaroon ng sakit dahil po nadala niyo po yung infection. Next slide po. COVID-19 Mythbuster. So ito po yung mga frequently asked question natin. Can the new coronavirus survive in hot and humid climates? Yes po. 2019 nCoV has spread to countries with with both hot and humid climates as well as cold and dry. Whether you live or whatever the climate, it is important to follow precaution. Wash your hands frequently and cover cough and sneezes with a tissue or a vent elbow. Throw the tissue in the bin and wash your hand immediately afterwards. Yun. Proper disposal pa rin po ang kailangan pag gumamit ng tissue. Does drinking alcohol prevent the new coronavirus? No, drinking alcohol does not protect you from COVID-19 or from 2019 nCoV. Reduce your risk of coronavirus infection by frequently cleaning hand using alcohol-based hand rub or soap and water. And when coughing and sneezing, cover mouth and nose with flex elbow or tissue. Yan. Parati na pong sinasabi yan, yung mga preventive measure natin. So, wag niyo po sana, isa puso niyo po sana kasi para po yan sa lahat. Next slide po. How do I ensure clothes and bed linen don't spread novel coronavirus? So, don't carry dirty linens or clothes against your body. Wash them in hot water between 60 to 90 degrees Celsius. Kung wala naman po kayo nung, kunyari, yung sinasabing automatic washing machine na may hot water setting, pwede naman po tayong magpakulo lang ng tubig, then ilagay po natin, ibabad po muna natin dun yung damit natin. With laundry detergent or soap po. If available, add bleach. Follow the direction on the package, machine dry or a high temperature or a dry in a direct sunlight. Then next slide po. Can COVID-19 spread through feces? Yung pong feces, yun po yung sinasabing yung waste po natin. Like other coronavirus, the virus can be found in feces, but COVID-19 spread primarily through close contact with an infected person or droplet release when they sneeze or cough. To protect yourself, wash your hands pa rin, yung preventive measure pa rin na sinasabi. So yun pa rin, yun at yun lang din naman po yung makaka-prevent ng cross-infection po. Then what type of, next slide po. What type of disinfection can I use to wipe down surfaces to protect against COVID-19? Actually, yung sodium hypochlorite po, ito po yung sinasabi natin na Sonrox po or chlorine. So may specific lang pong measurement yon. Pwede pong 1 cup na Sonrox, then 9 cups po nung 9 cups nung water. So parang 1:1 po yung magiging basis natin doon. Para naman po hindi masyadong harmful sa kamay. Kasi pag pumadami yung Sonrox, syempre, tapos minamanual lang natin yung pagpiga ng basahan, wala tayong gloves, pwede naman po na na-disinfect nga yung ating area, pero kamay naman po natin is nagkasugat-sugat na because po dun sa Sonrox. Next slide po. Drinking water alleviates a sore throat. Does this also protect against COVID-19? While staying hydrated by drinking water, it is important for overall health. It does not prevent coronavirus infection. Pero advisable pa rin naman po na uminom ng tubig kahit naman po wala tayong pandemic kasi nakakatulong din po ito sa system natin. Iba po kasing hydrated tayo. Pwede rin itong makatulong to lower down temperature kapag may ubo tayo para kahit pa paano maliquify yung dry cough natin. And then, basta po kung sakasakali po na meron kayong fever, cough, or difficulty of breathing, mag-seek pa rin po kayo ng advice kasi baka po kailangan nyo nang mag-take ng medication. So, next slide po. So, let's go to COVID-19 solidarity. COVID-19 is still around, but we can work together to prevent its spread. Remember, we all have the power to limit the spread of COVID-19. Let's keep working together to protect each other from the diseases. If we are careful every day and keep a protective behavior, we can protect our family members and friends too. Next slide po. Small acts of kindness can have a big impact to others during pandemic. If someone step aside to give you space while walking down the street, they may not be able to see you smile behind your mask, but you can give a nod or thank them for doing the right thing and helping to keep you safe. Then next slide. What the world needs now are good role models like you. If you keep a protective action against COVID-19, like hand washing, mask wearing, and physical distancing, then you're setting a good example and helping to protect your friends, family, and broader community. Next slide po. Even before the COVID-19 pandemic, life has had its ups and downs. So we are all on the same team. So it's humanity versus COVID-19. Remember that all people, no matter who they are or where they come from, need some extra support these days. So let's keep each other safe. We're in this together. That's all about my report. Thank you. Stay safe and stay positive.
All right, so thank you very much, Nurse Karen. So that is very informative. No, so we really have to protect ourselves, no, by following um, the guidelines set, no, by IATF, by the government. No, so we really have to protect ourselves. So if we can hand washing, we really have to follow the strict physical distancing. And if you don't feel well, then don't go out. No, until you're very sure that you're not feeling ill or you do not feel anything. So that's the way for us to contribute something to help mitigate COVID-19. All right. So for now, aside from the help of our school clinic, by the way, you could actually email our clinic. They are going to answer your queries regarding your health situation. You could consult with them via clinic@ntc.edu.ph. And aside from that one, all NTians, no, for this second semester are still going to be um, enrolled in Consulta MD. So what is Consulta MD? So you could get a doc anytime, no, via your phone. No, so this is a 24/7 hotline, and it is basically manned by a licensed doctor, a licensed physician, no, who can provide you medical assessment or basic healthcare and permissible medication over the phone. So our students, no, and all employees, full-time and part-time, and even the outsourced employees can avail of the services of Consulta MD anytime, anywhere during our coverage. Now, so for the whole second semester, we're going to be you're going to be covered by Consulta MD. So you could get immediate and unlimited access to a licensed Filipino doctor 24/7. All you have to do is to contact Consulta MD regarding your health condition. And you're going to be given an e-prescription via your SMS right after your consultation. You could also request Consulta MD for an e-laboratory via SMS. You have exclusive access also to various discount and benefits from their industry partners like Generica, no, Family Doc, Med Grocers, and more. And soon enough, Consulta MD will be having their video consultation via mobile and desktop application. So maybe we could just wait for the announcement of Consulta MD. So how does it work? So basically, the first thing that you have to do is you have to call Consulta MD hotlines at 79880 via your mobile, or at 0277988000 via your landline. Next is you have to provide your name and your student number or your employee number, and you can consult. Now, the rates are basically very affordable, especially if you're going to be calling via Globe. It's free. No, but this can really help you with the physical distancing because you really don't have to go out just to consult a doctor. So what are the different product features of Consulta MD? So there are telehealth consult. You have access to licensed Filipino doctors through the Consulta MD hotline. You could talk to them, you could tell them what you're feeling, and they could actually give you advices, medical advices. Consulta MD is a 24/7 hotline that would allow you to speak to a licensed Filipino doctor anytime, anywhere, no, and you could get primary advice on basic health care and permissible medication over the phone. So you could actually get yung mga reseta natin to buy your medicine no via SMS ibibigay nila yung ating prescription. Consulta MD doctors can provide you medical assessment and advice, and it includes Consulta MD doctors providing you the primary care. And they could also provide information on any health related inquiry, which includes the interpretation of your laboratory results. Now, and if you're feeling down, then they could also provide some primary mental health services. And this is going to be very important right now in this time of pandemic. Naka-lockdown tayo and the mental stress is very high. So, what other benefits can you get? So you could just visit Consulta MD's website for the different partners so that you could see other discounts or benefits that you could get through their partners, such as in MedGrocer, in Generica, Qualimed, in Family Doc, no, Metro Dental, High Precision. No? So just visit their website so that you could actually see what other benefits you could get by being a member of Consulta MD. So this is given again to all students and employees for at least for this second semester. So we hope that each and every member of Pamilyang NTC will take advantage of this telehealth plan. We pray that together all of us will rise above the situation. No? And we really hope that everybody will be safe, no, and will be healthy, and soon enough we're going to be seeing each other again at NTC, and we're very excited about that one. So before we end this orientation, may I call on the president of the student government, President Lance Riley Acebo, for some of his messages.
Thank you po, Sir Carlo. So, yung diniscuss po ni Nurse Karen po is a very helpful para po sa ating lahat, lalo na yung mga nasa bahay, yung mga students po natin na nasa bahay po ngayon, na mga pupunta sa school at yung mga ma-appointment, lagi niyo pong tatandaan yung mga health protocol na pinapatupad ng ating school. And also, please unawain po natin na kung minsan hindi po kayo pwede pumunta sa school sapagkat meron po mga health guidelines and protocols ang sinusunod ng school upang hindi ito masanction ng government kapag nalabag po ito. Ngayon po, NTCSG, kung may katanungan po kayo, lagi lang po kayo mag-message sa amin at kami na po ang magdidirekta sa mga concerned offices. Muli, maraming salamat po and magandang umaga.
Thank you very much, President Lance Riley Acebo. So I'm very proud of your president right now. Very active and very engaging. And I do hope that you are going to be supporting all the activities, the programs, and the plans of the student government. All right, so that concludes our health protocol orientation right now. So we hope that everybody is safe. So please follow the guidelines on how to stay safe. Please continue to frequently sanitize your hand, wash your hands, continue the physical distancing, and soon enough, malalagpasan din natin to, and we really hope that we could see you soon. So thank you very much, everybody, and God bless.